Hi, my name is Dina Schwarzkopf, and this is 6511 Advanced Diagnostic Reasoning and Health Assessment. And what we're doing here today is head, ears, eyes, and nose. What I'm going to start with is the eyes. And Gary is my husband, and he is going to be my partner. And he has allowed me to do this. So what I'm going to do is look into his eyes first. And what I'm going to do is look into the left, or the left eye. And so I will look from the left side. And let's see. What I'm actually looking for is any red, any redness of the eye, which is normal. Other things are nodules, veins that stick out. Those would be abnormal. So I'm going to go over to the right eye. And everything here looks normal. I'm not seeing any abnormalities. He is not a diabetic. He does not have any abnormalities with his eyes. I do know that. So the next thing that I will be focusing on is the ears and the nose. So we'll get set up for that. Go. And I'm going to go ahead and look into his ears first. And what I'm looking for. Is that hurting?
No.
And what I'm looking for is any kind of redness or pain, and I'm not seeing that. And can you swallow? I'm looking for any kind of bulging, anything like that in his ears. I'm seeing a gray covering. There's no redness. There's no nothing that is alerting me that he's got any kind of infection. Have you had any kind of infections in the past 2 weeks or 1 week?
No.
Or okay. Allergies or anything like that?
No.
Okay. What I'm going to focus on next would be the nose. And what I will do is look into his nose and see if I can see any kind of redness or anything like that. And have you tilt your head up towards the ceiling. I'm going to look into your nose here. And have you had nasal surgery in the past? I see a little white patch in your nose.
Yes, I've had rhinoplasty.
Okay. Did they put a patch in there?
Yes.
Okay. All right. So I see a little patch in the nose. Have you had what's been called a deviated septum?
Yes.
Okay. All right. So I see a little patch in his nose, which is consistent with a deviated septum, where they would go in and put like a septal button or a plastic patch over between the nares, and there is a little plastic patch in there, which is consistent with this, and I do see that. So that is normal finding at this point. What I will look at now is the throat, and I will have you open up your mouth, and we'll look in the back of your throat, and I'll try to have you stay as focused to the camera as you can, and we'll look in the back here and say, "Aww." Okay. And what I'm noticing there is no redness at this time, but I'm noticing there's no uvula. So have you had surgery?
Yes, I have.
Okay, what did you have done?
They took that out because of sleep apnea.
Okay. Uvuloplasty?
Yes.
Okay. It's called surgery, which is called a UPJ or uvuloplasty, and they removed the uvula, and they also took out a portion of his upper um, roof of his mouth and kind of closed that up because he has a problem with snoring and breathing problems at night, and it is normal with this finding. So next we're going to move on to check his thyroid. So what I'm going to do is have Gary swallow some water, and I'm going to check his throat. And do we have some water here to have you drink? Okay, I'll give you this. See that? Okay, so what we're going to do is I'm going to have Gary take a drink of water, and what I'm going to do is check his throat to make sure when he swallows, okay, that there is no bulging. I don't feel any bulging here in the thyroid area, isthmus area. Everything feels normal. And do you have any difficulty swallowing?
No.
Okay. So we're checking for that, and I'll let you put this down.
Yeah.
Okay. The other things that I want to check on the head, ears, nose, throat would be glands or lymph nodes in the cervical area and the throat area. So what I'm going to do is palpate these areas, and I'm palpating for any kind of tenderness. And you have any tenderness, swelling? I am not finding any tenderness or any kind of swelling. Do you have any pain?
No.
And this is preauricular, postauricular, cervical, submandibular, right in this area, subtonsillar, cervical, and deep cervical, and then clavicular in these areas. And I am not finding any lymph nodes or any abnormal findings in these areas. The other thing that I would like to look at, because everything looks normal, I'll go back in and focus on the ears, or the eyes, I'm sorry. And what I'm looking for is any kind of swelling, redness, edema, or itching. Gary, do you wear contact lenses?
Yes, I do.
Okay. Do you have any problems with your contact lenses?
No.
Okay. No problems with itching, irritation, anything like that?
No.
Okay. What I'm going to look for, I'm going to pull your eyes down. Look in your subconjunctival areas, and I'm looking for redness, edema, or swelling. No problem with that?
No problem.
Okay. Okay. No problems with that? Okay. The other thing I'm going to do is I'm going to refocus on Gary's eyes and make sure that there's no problems with Gary's vision. I do not have a Snellen chart at this point. Gary, can you focus on the clock on the wall there? We do have a clock across the living room. I do have to estimate this is about 15 feet. Can you cover one eye and read the clock there at this time?
Yes.
Okay, can you tell me what time it is?
It's 6:40.
Okay. Can you cover the other eye? And what time do you see on the clock?
6:40.
Okay. It is, I want to verify that it is actually 6:40 on the clock according to the clock on the wall. What I'm actually going to do now is just look at Gary's vision as far as making sure that his eyes are not having any problems as far as strabismus, nystagmus, anything like that. Okay, so what I'm going to have you do is I'm going to have you look over my eye, or my shoulder, and I'm going to just focus on your, you just look over my shoulder, just look straight ahead, and I'm just going to have you focus on my finger, and both eyes just go in as far as you can. Okay, both eyes. Okay, can you use both eyes? Go in as far as you can. There you go. Okay, now follow my finger with both eyes. Okay, don't move your head. Very good. Okay. All right. So what I'm seeing at this point is acceptable for the exam, and everything is acceptable at this point.